Hi, my name is Ian and I'm a Year 3 nursing student.
And I'm Yati, a Year 2 nursing student.
And today you're with us here at NHS and you'll be following us on our door-to-door screenings.
We are really glad to have you here today, so let's go!
Ian and Yati are volunteers participating in the NUS Yong School of Medicine's Neighbourhood Health Screening program. This community-based health screening program is one of the most comprehensive ones here in Singapore. It provides a one-stop shop service, screening residents for chronic diseases, vision, oral health and hearing, cancer, fall risk, and mental health. Over the past 11 years, it has served over 5,000 residents in different low-income districts all over Singapore. But Ian and Yati have a more challenging task on their hands. They are off to the rental flats where the majority of unscreened Singaporeans lie.
Hello. Okay. So Yati, is it very normal for people not to answer?
Yeah, it's quite common for people to not answer the door.
But do you know why?
Sometimes they are not home, but sometimes they just refuse to they just don't really answer so that they don't have to entertain the people.
After knocking on a few doors, Ian and Yati finally find a resident willing to be screened. Let's meet their team.
Alright, before we start, let Yati and I introduce you to our team.
Hi, I'm Pigeon, Year 2 Nursing.
I'm Mark, Year 1 NTU Maths.
Okay, so now let's go meet our first resident.
Madam Tana Lechmi is a 75-year-old resident who lives alone in her rental flat. She's very receptive to the team and they were able to give her a comprehensive health check. The home screening usually begins with a health assessment of the patient's vital signs, such as her blood pressure, blood glucose, and heart rate. For many nursing students, NHS is a good training ground to use the basic nursing and communication skills they pick up in the first year of nursing school.
Okay, so Yachi is actually doing the manual blood pressure for the patient right now to just kind of see how well she's doing. So we will do this kind of 3 times to make sure that the values are right.
After taking Madam Thana's blood sugar reading, the team found that the result may require a follow-up.
Yes, considering the fact that she's on medications and she hasn't had breakfast, 70 values are quite high. So we are going to actually call the guy in charge of the emergency service and he's going to come and have a look.
Okay, Yati, so what are you doing now?
So right now we're just measuring her waist circumference and her height and weight so that we can calculate the BMI later.
The comprehensive screening even involves a check on her vision.
Glasses?
No.
No glasses at all.
This one?
Okay, Yati, what are you doing now?
We are just listing down taking some medical history of the patient, profiling. So basically we will ask her about her conditions and what medication she takes and everything.
The students start their medical questioning session with Madam Thana to find out her medical problems and risks. They are guided by a detailed NHS questionnaire.
Then you got ever give your your pass motion? You got ever take the sample and give the test?
No.
Never give before. Even in hospital they never take. No. Okay.
Last time, no.
Last night.
Yesterday.
Yesterday night you got take or not?
Yeah.
Yes,
Take.
How often do you take?
This one.
Every night.
Every night.
As health is not just governed by biological factors, the students also conduct social assessments to see if there are issues that may impede Madam Thana from getting proper medical care.
You got any financial assistance? Anyone help you or any
Other than your children, anyone else? You get money from anyone else?
1 month, give 1 month. Little bit.
From people? Who
My
give you?
children.
All children?
Other than
children?
government got
Government?
Yeah, government.
Got give.
The information gleaned is then used to give patient education so the patient can follow the advice given and gain better health.
Something must go and check if got bleeding or anything because very easy to infect. So then your eyes also must go for regular checkup.
Yeah.
After spending almost 3 hours with Madam Thana, it's a wrap. The team passes Madam Thana her health report, gives her some final words of advice on her conditions, and take their leave.
You don't rush. Okay? So this one, just be careful so that you don't fall. If you fall, then we'll have more problems. Okay? So this one, I pass to you, you can keep. Then next time anybody asks you, your doctor or whatever asks you, right, or your children come, you can show this to them.
Okay.
Okay?
Yeah.
Auntie, you got any questions for us? ஏதாச்சும் கேள்வி இருக்கா?
இல்ல.
Yeah, okay.
We catch up with Ian on his experience working in an interprofessional team to conduct Madam Thana's health screening.
Okay, the experience was actually very good. So I would say all the team members collaborated well to actually do different parts of the health survey and the whole flow. Right. So nursing students, I think the very good thing about us is that we are trained to see patients very holistically. So not, like I said, not just the medical issues, but we also train to see how their psyche as well as their social issues actually come together to form the person and also affect their illness. Nursing students can offer that perspective to other professionals who might see only certain parts. So we help bring it back to the real issue, which is the patient.
Yati, so what have you learnt about caring for patients in the community?
I guess it just reminds me that there's a lot more that I can provide than just basic nursing skills. Like, not just like the medical, clinical aspect, but like they actually have a lot of other problems. Like even if the main concern is actually their conditions, but maybe they have like issues, like social issues that leads to the medical condition. So like, I guess it's a reminder that I shouldn't be focusing so much on like what they are presented with at that point of time, but like to look at everything as a whole. So.
Ian, how does NHS change people's perception of nursing?
It would up people's perception of nursing because when nurses go out there and give their inputs, right, we are actually heard. So when we go out there into the community and we use what we've learned to actually deliver holistic care, people actually see it. And like for example, the first resident we saw just now, she was very shocked to find out that I was a nurse.
I think you doctor.
So this brings us to the end of our health screening today.
We hope you enjoyed your time with us and learn a little bit more about what nurses do.